Okay, this video called History of Healthcare, the Last 30 Years. We'll start out with some of the successes. Some of the biggest successes are what you'd expect. There's been a big improvement in computers and machines the last 30 years, so the same thing is transferred to medicine, especially, for example, CT scan means computed tomography. It's often called CAT scan. That just means computerized axial tomography, transverse slices, but we now view them all the time in coronal and sagittal views as well. They're a lot faster, the CAT scan machines, so they can take thinner slices, reconstruct in all directions. So the pictures are better. When I first started out my training, a patient with a really severe abdominal pain, they'd go to the operating room for an exploratory laparotomy. Nowadays, one just gets a CAT scan, and most of them don't need exploratory laparotomy. So the ability to diagnose disease is dramatically improved with the improvements in CAT scan, MRI, and ultrasound. You can inject IV contrast and obtain opacification of the arteries and get a CT angiogram. It's called a CTA. And you can look at the arteries of the brain, the arteries of the heart, the arteries of the abdomen and the lower extremities. So diagnosis through imaging has dramatically improved. MRI has gotten a lot better for looking at the brain. The flare sequences show the silent strokes, so to speak. The DWI, diffusion weighted imaging, shows the acute strokes. The SWI, susceptibility weighted imaging, shows cerebral microbleed. So there's a lot more that can be seen to make better diagnoses. The procedures have improved a lot too from imaging guided surgeries. I did fellowship first in imaging guided surgery before doing one in neuroradiology. And when I was an intern on surgery, I did a surgical internship. We'd walk around putting in central lines, and as an intern, I'd have to hold the patients down while the senior and the junior would put in the lines. And it was kind of a miserable stuff. We have confused patients and old nursing home patients and stuff. And everything was just palpation by landmarks, usually going into the subclavian vein. It dramatically improved once ultrasound was available for image-guided venous access. The biopsies have gotten better and better with ultrasound and CT, and more abdominal procedures. Used to be abscesses were drained surgically. Then they just drain with CAT scan and Seldinger technique. It means to place a coaxial tube through CAT scan guidance so you don't have to do a big open surgical procedure. Gallbladders, chest tubes. So a lot of good stuff has happened. Pathology's gotten way better with all their different variety of stains. Biopsies that used to require multiple core specimens with a relatively big needle, let's say 18 gauge, now can routinely be done with 25 gauge needles. That just means individual cells rather than chunks of tissue like an inchworm is a core biopsy. Laparoscopic surgery has gotten dramatically better, and that just started becoming widespread around 1990 for gallbladders, of course for all the gynae stuff, and for a lot of other procedures as well. The ERCP scope guys, the gastroenterology, can do a lot more for pancreas biopsies, management of pancreatitis, pseudocysts, pancreatic other pancreatic issues as well. We'll leave it at that. The radiology images used to all be hard copy, and often stuff would get lost or no one could find it. Nowadays, it's all on computers, and so stuff doesn't tend to get lost. It's much easier to compare. That's a big improvement. The medical charts have all become computerized electronic, so stuff doesn't get lost so much. It's much more likely to be able to find stuff and be able to read it. Infectious disease now routinely manage these HIV patients. When I started out my training, they all died pretty fast. Nowadays, they live a long time. Hepatitis, same sort of thing. Patients living much longer than they used to. So there's a lot of dramatic successes in healthcare. And I can tell you, doctors want to help. I know tons of doctors, and the vast majority, almost all of them, they're nice. They want to help the patient. It's uncommon to meet a doctor who's I mean, there are some, but it's uncommon to meet one who doesn't have what I would call the best attitude. But they have to follow the rules. Most of them are overworked, they're tired, they have to follow the rules, and once they get done with all their training, they're kind of exhausted, and then they decide to have a family, and then that keeps them up at night and tired, and then CME doesn't really require them to learn anything, so it has to come from the individual's desire. Otherwise, they don't learn stuff. Okay, categories of disease. This is important because in order to think in an intelligent way about healthcare, you gotta these basic categories of disease. So acute disease is a relatively small percent. Let's ballpark it at 10%. And the United States is the best in the world at this type of stuff. There's a lot of really good doctors in emergency room. Emergency rooms save tons of people's lives. They skillfully manage a wide variety of problems. Acute myocardial infarction goes from the ER, goes to the cardiac interventional cardiology suite. They pop in a stent. That'll save a person's life with acute myocardial infarction. For trauma, they're really good. And all kinds of, these are just typical emergencies you see every day. Pulmonary emboli, pneumothorax, kidney stones, appendicitis, diverticulitis, cholecystitis, PID, orchitis, tonsillar abscess. I mean, these things get routinely handled, major emergencies, routinely handled like it was nothing every day in emergency rooms. Okay, and then by the specialties that help out and take over the patient's care. Also for end-stage disease, United States is best in the world. Let's say somebody's got kidney failure. They're very good at putting a person on dialysis. It could be hemodialysis with the blood, through the abdomen, peritoneal dialysis. Transplant surgeons, there's a lot of dedicated, good transplant surgeons. I mean, nowadays they can transplant livers, they can transplant hearts. So they're good at fancy, complex, end-stage care surgeries. TIPS procedure, transjugular intrahepatic portosystemic shunt. Interventional radiologists are good with that. And they're good at replacement of medications. Let's say you got thyroid failure, you can get thyroid hormone replacement. You got dopamine failure, so to speak, with Parkinson's disease, you can get that replaced with the medication L-Dopa. So if a patient has a worn out joint from severe arthritis, they'll put in a joint replacement and they're good. Hips, knees, shoulders, and a few other things as well. Spinal cord injury patients, when I was a young guy just starting out in medicine, they used to not live long. Okay, nowadays it's pretty routine. They live 30 years or more. This includes quadriplegics. So I want to make it clear, medicine's really improved at a lot of stuff. Cancer is kind of so I said acute disease is 10%, end-stage disease is about 15%, so now we're about 25% overall. Cancer is another 5% approximately. And the big problem with cancer care is I think they really should pay more attention to the metabolic theory of cancer, the Warburg effect, because if they did, I think that would help. But, cancer docs are pretty smart. They know all the genetic theory of cancer stuff. They know a lot of stuff, but I think they should also really study the metabolic theory of cancer. And, you read books like The Emperor of All Maladies. It's a very famous best-selling book about the history of cancer. It's called The Biography of Cancer. And it does emphasize the successes with chemotherapy for so-called liquid cancers, things like leukemias and whatnot. But it really doesn't address a lot of the issues with regard to solid tumors and with regard to the Warburg effect and metabolic theory. So be that as it may, that's something that they need to improve. And when they do, they'll make big improvements in their outcomes. Okay, chronic diseases, and that's about 70%. So that's most disease. So I think people usually don't realize that, but most disease is chronic, and that's not good because the word chronic means that it never is cured. By definition, never cured. And there's a reason for that. Why is it that these diseases, obesity, diabetes, hypertension, fatty liver, coronary artery atherosclerosis, heart disease, dementia, well, dementia is a special category. That's a little bit different, but these other diseases, these chronic diseases are never cured because they're dietary diseases. You can't cure them with a pill. The pills do slow things down, and that's a lot better than nothing. And it's also true, the vast majority of patients, in my experience, I'd say 95% of people, maybe more than that, they're really not capable of changing their diet, as simple as it is, But most people, what I've seen, they can't do it. I mean, it sounds like it's easy, but they just can't do it. They simply, deep in their heart of hearts, don't believe it. And therefore, they're not motivated to change. And it's hard to shake them out of that. They're not interested in learning, so they're not able to learn. So anyways, I don't ever think dietary stuff is going to be a big part of medicine. But, an intelligent person who's willing to change should at least have that option. Okay, so here's some of the failures, I would say, in the last 30 years of healthcare. There really is an incredible lack of knowledge about nutrition and toxicology. And like we just said, this is about 70% of disease in that ballpark. There's doctors like, I think I've heard McDougall say he thinks it's 80% of disease. And I've heard other, famous nutrition experts, they're in the same ballpark too, T. Colin Campbell and others. So there's almost a complete lack of nutrition knowledge and toxicology amongst most physicians. Because I talk to doctors every day and we talk about nutrition, and I'm always the teacher. It's pretty rare that somebody's actually read a lot. There's a few docs who've read a lot, but amongst the ones I know, and I know a lot of them, almost none of them have done any significant reading about nutrition. A few of them have, and they're starting to because they're trying to help themselves. Especially as they get older, they get more health problems, okay? And, the real thing is you have to get this clear in your head. Meat is a metabolic poison, okay? You have to get that. If you don't get that, you can never really progress. And for a lot of people, that's a very difficult thing to grasp. Vegetable oils, they're all bad. You have to get that. If you don't get that, you're not going to make much progress. Okay, people should know something about blood flow. It's pretty simple. Sodium is a vasoconstrictor. So if you're trying to heal something, this is healing anything in the body, you don't want a lot of sodium on board. Fat decreases oxygen delivery to tissue. So you don't want a lot of fat on board if you're trying to heal something. And a lot of times that's what a doctor's trying to do. Heal a wound, heal an infection. Okay, you also want your vasodilators on board, your potassium and your magnesium. They come from eating plants, okay? So if you want good healing, you want to avoid fat, avoid sodium, and get the vasodilators in there, and the nitrates as well. Eat the salads. Endocrine, okay? I know a lot of endocrinologists are nice, but in my experience, most of them have not done the reading that they should about type 2 diabetes. I mean, they should know it's caused by fat. Most of them don't know that. That's an easy thing to learn. It's easy to read about. Cardiologists, it's been shown now by Kempner, Pritikin, Blankenhorn, McDougall, Ornish, Esselstyn, Sloop, Roberts, and others, Armstrong, that coronary artery disease is totally preventable and partially reversible with a low-fat, 100% vegan diet. Okay, that should just be common knowledge, but it's not. And hemorrheology should be common knowledge. And if anybody wants to get started on understanding atherosclerosis in a serious way, read Sloop's book, Gregory Sloop, MD, about cardiovascular pathophysiology. It's the best book. Rheumatology. They should know about leaky gut. Most rheumatologists do not know leaky gut. It's not in the standard, medical school textbooks. If you want to heal autoimmune disease, that's like the first thing you should know about is leaky gut. Neurologists are pretty dedicated and pretty interested in learning. That's been my experience with them. Most of them, though, they have not been educated in nutrition. They don't know about leaky gut and its role in MS. They should read about Roy Swank. That'd be good for them. General surgery. General surgeons are real hard working, but most of them don't know Burkitt's work on abdominal pressure syndrome. That's something that they really ought to know about. It's pretty simple to learn. It's a pretty simple concept. Constipation due to lack of fiber causes back pressure, and that leads to all kinds of things in the abdomen. Hiatal hernia, varicose veins, hernias, etc. Okay. Hypertension is especially due to dietary fats, animal protein because it raises cholesterol, sodium, sweets causing obesity, stress, and stress equivalents. All right, and so this comes internal medicine. Now, I know lots of internal medicine docs. They're very nice, and a lot of them are very bright. They want to help their patients. Most of them, though, they don't know as much nutrition and toxicology as they should know. And it's pretty easy to learn this stuff. You basically got to spend about 4 months, to get solid on the basics. About 2 months on just watching nutrition videos and reading some paperback book of something, whatever they choose to get them going in the field. And within 4 months, they'd be pretty good. There'd still be a ton more to learn, but they would be solid on the basics. Okay, and here, you can just, next 2 lines, just understand this. The best diet to make a person healthy, low fat, low sodium, 100% vegan, whole foods, no meat, not one bite, no dairy, not one bite or not one drop, no oil, not one drop, no sweets, no caffeine, no alcohol. And it's important to get that right. If you're just eating a little bit of oil, that can keep you fat and keep you sick. And old people, they're compromised in their health. They can't afford to not do everything optimal if they really want good health. And it's important to get that straight. Everything, in moderation doesn't work at all. Those people don't tend to do well. No one thinks it's a big deal to undergo severe chemo side effects or open heart surgery. Why is it such a big deal to only eat plant foods? It's not really a big deal at all. And if the patient doesn't want to do it, fine. And I realize probably 95% won't. That's fine. But that 5% who, are willing to change, give them a chance. Okay, most common toxins, pretty easy stuff to learn about. Most important is learn about the estrogenic chemicals. Very simple subject. And then there's other ones, MSG, MFG, aspartame, F-GP, and all that stuff. You can learn that later, but this is basically the overview of how healthcare works and what the issues are. So, hope that's helpful.